So today we're going to look at the gross anatomy of the heart. This image actually doesn't have step-by-step images in the book. However, I was asked to do some teaching on Tuesday for Cardiff MedSoc, and they were interested in the gross anatomy of the heart. So I thought I'd just go through it so that we've got an example of how you could just easily draw the heart. So to start with, I'm going to draw a sac. And then I'm going to draw the muscle. So the muscle is very thin at the top, and then it gets thicker at the bottom. And then same, the left is going to be bigger than the right. And then what we did was we added in the vena cava. So we've got here the superior vena cava, and here the inferior vena cava. Next, I thought we'd add in the valves. So you have the pulmonary valve, which has 3 leaflets, the tricuspid valve, which has 3, the aortic valve, which normally has 3, and then the mitral valve, which just has 2. In between, we have the septum, and this is muscle, obviously. So this is the interventricular septum. So next we will add in the tendicoordinae. So from each of the mitral valve and the tricuspid valve, from each leaflet, we just draw something that represents some of the tendicoordinae, as shown here. So this represents the right ventricle, and this is the left ventricle. This is the left atrium, and this is the right atrium. So blood enters through the right atrium, it passes into the right ventricle, and then it goes through the tricuspid valve, comes out the pulmonary valve, and it goes into the pulmonary artery. Now in this drawing, we're doing it in blue because that blood will be deoxygenated. So it is an artery, but it's deoxygenated blood. The blood then goes through the lungs and then re-enters the heart through the pulmonary veins, which are actually represented as red because they're now oxygenated from the lungs, and this goes from the left atrium through the mitral valve into the left ventricle, and the muscle then pumps it through the aortic valve, and this then goes into the aorta. So you can draw a few branches off the aorta if you want to. So you've got your brachiocephalic artery, your left common carotid artery, and your left subclavian artery. So the nerve impulse, so you start at your sinoatrial node, and then this passes through the anterior internodal tract, the middle internodal tract, and the posterior internodal tract, and these go to the AV node. So I just draw it as like 3 lines just to represent the different tracks. So you have 1, 2, and 3. You also have a bundle that goes into your left atrium, and this is Bachmann's bundle. And then from the AV node, this impulse then travels down the septum into the tendon, into the ventricles, all the way around, and this is how the electrical impulse will travel through the heart. So that's pretty much the most simple way to learn the gross anatomy of the heart. There are quite a few other things that we can look at, but to start with, it's quite useful to kind of get your head around this, so you can consider the way the blood flows through it, and then also the way that the nerve impulse travels.